Hello, I am Urologist Ömür Erdem Akkaya. Today we will have a video presentation on the use of anabolic agents, their harms, and side effects in women. The use of anabolic agents in women actually dates back a long time. While addressing this issue, it is absolutely necessary to mention the biggest anabolic use program in history, which was made in 1997, because there is a group of women who have experienced the use of anabolic agents the most. This experience was made by thousands of athletes, women, men, children in East Germany during the Iron Curtain period between 1960 and 1990. This is also a program implemented by the state under pressure, without the consent of the family and the individuals themselves, and together with professors and sports coaches at universities. Here, intensive use of anabolic agents was applied to women. Turinabol was applied the most at that time. Many anabolic substances have been used, including testosterone esters. It was a study that lasted 30 years. The reason it took so long is that serious successes were achieved in the Olympics. The records that were broken at that time have still not been broken. In 1989, as a result of the serious increase in the use of anabolics worldwide, the Olympic Committee established a strict control mechanism against athletes. After the year 1990, serious decreases were observed in the success of the athletes. In the end, being successful is a vital issue for the athlete. And the use of anabolic agents in women has the following benefits. After androgenism develops in a woman, a certain amount of muscle mass remains and these are not separated from the body. She can use them later while doing sports. And even if she excretes this substance, it can have lasting effects on muscle tissue and body tissue. This increases success in sports. With the disappearance of the Iron Curtain in 1990, end of state repression, many people defended their rights and opened a court on this issue. It was a painful event because it was unethical and nobody's consent had been obtained. It was a difficult and troublesome process. So how is the situation today? Today, the use of anabolics has recently increased its popularity among women as it is among men. Women use anabolics to achieve a beautiful body image and to lose weight. Apart from that, if a bad event has happened, she uses it to feel power and self-defense. They also use it to integrate into a social environment. Women are less fortunate than men when it comes to use, because men are more experienced. Anabolics are incompatible with the nature of women. Because the hormones that function in women are estrogen and progesterone, testosterone is present in low amounts. Women can be strongly affected even at very low testosterone doses. For example, although we do not know which dose will cause gynecomastia in men, voice changes may occur in women even with very small doses. Many drugs are already being sold illegally. There is a problem with the drugs being safe. Many surveys have been conducted on women. One of the most asked questions has been why they have used this substance for years. The answers of the women in general are as follows: although I saw and knew the side effects, I felt comfortable when I used anabolic agents while doing sports. I was more comfortable socially. I was not worried about the side effects. This is a very interesting and different situation. What are the side effects? Briefly, there may be hair loss, facial hair growth, beard growth, hair growth extending from the groin area to the chest area, changes in the tone of the voice, irregularity or lack of menstrual periods, shrinkage in the breasts and shrinkage in the labium majus area in the vagina. Sex drive in women can be stimulated too much. This situation is also a very troublesome situation among women. Side effects can be permanent. It can improve after years. Changes related to tone of voice make women very uncomfortable. While talking on the phone, the other party can think that the person they are talking to is a man because they cannot see her appearance. This situation puts the woman in social distress. Regarding voice changes, they may have to undergo surgery. There are cases of surgery. They also stated in the survey studies that the sound change can return after years, but never return to its old, original form. Studies on this subject are limited. The clitoris is growing and is permanent, but it has been said to be reversed in some survey studies. It is unclear what will be in what dose and so it is dangerous for women. It is completely against the nature of women. Therefore, They are drugs that should not be used. Thanks for listening, best regards.